As I welcome you into Kumasi, the city in Ashanti region where we used to have about 1.5 million people visiting a day. We first had the COVID-19 case in the second week in March, and immediately it landed in Ghana. The president immediately took several actions to make sure that we stop the spread and also stop the importation. So some of the actions that the president directed that we all have to ensure was first the closure of schools and churches and public gathering. So that was the first action that we took. And after the closure of the school, churches, and public gathering, the next action that we took was the closure of our borders. You know, Kumasi is a trading center, so if we close our borders, it means a lot to us. Then when the COVID cases start to increase, the president immediately ordered a lockdown of the city, that is the affected cities. And I'm talking about Greater Accra and Greater Kumasi. And the lockdown was in force for almost 2 weeks. That is where 3 weeks, that is where we had a lot of challenges. So when the city was locked down for 3 weeks, it became our duty to feed the less endowed people and also to make sure we have adequate security personnel on our streets to make sure that people comply with the lockdown. Kumasi being the city center, our shops, as well as our market, we have several markets in West Africa. We have the largest market, and therefore there was the need for measures to be put in place for rotational basis so that the traders will have to trade in 10, as well as all the other markets, because we are having more than 23 markets. And the drivers were directed that they can't take the normal ones. The flights were all asked to stop. So when all these things were going on, the Herculean task that came on the city was the supply of PPEs, because the private hospitals as well as the government hospitals were all depending on the metro for support of the PPEs. As I sit in my office today, I have more than $520,000 in arrears to pay for the PPEs that I have taken to supply. And this COVID-19 has really brought a lot of challenges on the assembly, because per our rules and per the laws in Ghana, each assembly has January to March to serve demand notices, and by law, all companies that know their law will not even pay, because they know they have at least 3 months to start the payment. So as we were preparing to start going for money from the corporate bodies in the area of property rates, in the area of business operating permits, fees and others, then came the COVID, and therefore our hands were so tight. So currently, the assembly has started losing almost about 1 million a month. The assembly is losing 1 million a month in dollars. And we are projecting that the assembly will be losing not less than $4 million this year, because it has greatly affected us as a trading city. But even though it has really affected us as a city, we are also trying to put up measures in place so as to solve the financial pressures generated by the outbreak. So among the measures that as a city we have taken is to limit expenditure. So now we are only spending on essential activities, especially in relating to the COVID-19, how to solve the problem, how to chase out the virus, how to make sure that at least we are paying our workers, how to make sure that we incentivize the health professionals, how to make sure that those who have been recruited to be doing contact tracing get their motivations and others. So that is exactly the area where we are spending now. But as for expenditure on capital expenditure, they are all on hold. Another area where we are now dependent is the central government. And the central government has helped a lot. Within this short space of time, the central government contracted 4 major companies want to do infestation. So all the markets were sprayed against infestation, and disinfection exercise also went on. And again, one thing that we are also doing is that we are relying on the corporate bodies for support, relying not only on the corporate bodies, but our development partners, so that they can come on board and help us. COVID-19 has really done a big blow to us, but we've learned a lot of lessons from it. Because now there has been the urgent need for us as a city to put up public infrastructure for social services to increase resilience. And secondly, there's also the emergency and immediate need for equipping and resourcing the Public Health Emergency Committee to deal with the health-related issues. And finally, now as a city, we have resolved that going forward, we are going to invest 5 to 8% of our internal generated fund into government bonds, so that in the near future, should there arise any pandemic, we will be having money to spend.